Evening. I'd like to welcome everyone to the November meeting of the Pitt County Board of Health. Sort of a cool football weather type meeting tonight. The first thing we'd like to do is see if there are any public comments. First of all, call to order, and then secondly, are there any public comments? Hearing none, we'll move on to the minutes of the previous meeting that Dr. Hayes was kind enough to chair in my absence. Are there any corrections or additions to those minutes?
No.
Hearing
Move that
none.
it be approved.
Motion made.
Second.
Second. Okay. Any further discussion? Excuse me. All in favor say aye.
Aye.
Any opposed? All right. The minutes are approved. We'll move on to the fiscal report.
October 31st, 2018, period 4 for this fiscal year. We did have some budget amendments. We received $202,000 from DHHS for our vector control, and also $39,652 were added to the budget for the on-site environmental health position. This is not for a full year. This would be anticipated hiring in December. Which increased our overall fiscal year 2019 budget to $11.6 million. Looking at it from a pro rata, of course, we've got a deficit due to some of our timing issues. We do have some encumbered purchases of $55,000 roughly. But year to date, we have a surplus of $208,000 when you take in consideration of the timing issues. Have any questions?
Do we have a three paycheck month coming up, or?
I'm sorry, what?
Do we have a 3 pay period month
We
coming
do in September.
September. Okay.
No, wait a minute. No, we just did. We will have one in March. Yes, sir.
Okay. So if we're still, if we're in the black, that's a good thing.
We're still in the black. Yes, sir. We do have some timing issues. We are working on our Medicaid cost report study. It's just a huge report, and the figures just got released from DMA a month ago. So we're still working through that. And of course, Epic, we're still finding different things with billing. So yeah, it's a very busy place. We also will have some more budget amendments next month as well, concerning TB and the opioid that was in the paper today. So that will be for next month.
Okay. Does anybody have any questions for Marcia? All right. Is there a motion to approve the budget as presented?
So moved.
Is there a second?
Second.
All in favor say aye.
Aye.
Any opposed? All right. Thank you very much, Marcia. We appreciate it. All right, we'll move on to the old business. We have the hiring freeze exemption for nurses update.
That would be me, Mr. Chairman. I just wanted to update you that we did go to the county commissioners last month with that request, as y'all directed, and that was passed by the county commissioners, and so we've implemented that. Dr. Hardy is recruiting nurses as hard and as fast as she can. She's had some interviews recently, and but they're few and far between and difficult to recruit, as we know. So, but we know that they doing away with that hiring freeze has helped to get advertising going quicker when someone leaves, and hopefully we'll get somebody in faster too.
Okay. Good luck.
Yeah,
we have the same challenge at the hospital with hiring as well. So, okay, we'll move on to, if there's no other old business, move on to new business, meningococcal B vaccine fee.
You should have a handout in your packet about meningitis serogroup B vaccine fee. This is a vaccine that's used particularly for young children 10 years and older that have specific problems such as a damaged spleen or complement deficiency, or if they're on particular medications. So we've added that meningitis vaccine to our formulary at the health department. The fee for this is pretty expensive. It's $165. This is not a vaccine that's used very frequently. It's for specific populations. So we're just requesting that we get that fee put into our formulary.
And do we have another vaccine that's already on the formulary, but it's the broader vaccine?
We do have Menactra, which
Menactra.
is the AC and WY
Okay.
for serogroup. So this is for the serogroup type B that would be added.
Does anybody have any questions or comments?
It's covered by insurance to some degree, or?
Yes, it
So-
is.
Okay.
Yeah.
This is sort of what we call a niche vaccine. It's for a specific, very specific subpopulation of folks that may very well have a serious, if not fatal, as Dr. Morrow mentioned, fatal episode of meningococcal B
That's just-
infection. So, other comments, or is there a motion to approve?
So moved.
Second. Any further discussion? All in favor say aye. Aye. Any opposed? All right. Motion passes. Tobacco-free parks.
Tobacco-free parks. And just a reminder, we've sort of been around the block with tobacco-free parks. We had brought the Board of Health rule that was approved several years ago, went to the county commissioners and was voted down 5-4. That rule would have put a uniform rule into place across the county, including all the 10 municipalities and the county park, Alice Keene Park. Since that did not pass, we had to go back to the municipalities that were asking for tobacco-free parks. All 10 municipalities had passed a resolution supporting the Board of Health rule. So we went back to those municipalities. We've been doing that for some time now, and Ayden, Winterville, Grifton, and Bethel are the 4 municipalities that have all passed tobacco-free parks. We went last week and met with the Greenville City Council at one of their workshops, and that received a lot of press. But they will take that issue up, I think, in December, at their December meeting. So we hope to have Greenville with tobacco-free parks, and that would also include their Greenway. But Greenville has most of the parks in the county. And then left to go is Farmville, Fountain, Falkland, Grimesland, and Simpson. And so we're be in conversations, particularly with Farmville. We've already had some conversations with them, but we'll be in more conversations with them very soon about getting it passed in Farmville. I think the other question that comes back to this board would be whether or not the Board of Health rule might be taken back to the county commissioners after the election with change over there, if it may have a better chance of passing, and that would make things, again, simplify things in terms of enforcement and having a uniform rule across the county and all the parks, and would save us the trouble of individually going to 5 more municipalities. So I just wanted to update you about that and what's going on. But I would just remind people, our audience tonight, that tobacco is a priority for this Board of Health and has been now for several years. It remains to be the #1 preventable cause of death and disability for our citizens of this county. And we're very concerned right now about the escalation in the vaping by our youth. So another initiative that is being supported by the North Carolina Association of Local Health Directors is Tobacco 21, which would push the age of purchasing tobacco up to age 21 from age 18. And that's been proven in other states to be very effective at decreasing youth access and use of tobacco products, including electronic cigarettes and other vaping products. So that is one of the legislative priorities for our Association of Local Health Directors going into the General Assembly, which starts back in just a couple of weeks. So we're hoping that we can make some traction with that this year in the session.
With the parks that are already tobacco-free, does that include vaping as well?
Yes.
Okay.
Now, whether Greenville's will is yet to be
Yes.
determined,
But for
yes.
Ayden and Winterville and Bethel and Grifton?
Yes.
Okay.
So it's considered a tobacco product.
Mm-hmm.
The other thing that Greenville discussed and may be discussing more, I think, with their ordinance is public places, which many of the cities have done. And I think I have a handout here that I was going to pass around. And this just lists, you can see different municipalities around the state that have done different ordinances and what they cover. So we've got a ways to go here in Pitt County in terms of our municipalities, but you know, some places across the state have done a really good job. Bessemer City is one I think that's probably above everybody else. It's not a very big town, but they've really done some progressive things. Durham is another one, Cherryville. So a lot of them are doing these types of ordinances right now, currently. So.
Commissioner Colson, do you have any advice on this? I couldn't remember what year it was, but Dr. Marr reminded me it was 3 years ago when we came before the 2015 to make. Dr. Marr made the proposal, and he.
No, not really.
No.
It just, I mean, I'll be very honest with you. I have mixed feelings. If you're an adult at the age of 18, then I have trouble with that. You serve in the military, and yet you're not allowed to do this. I don't know.
Tough call.
A lot of people look at the history of it. I remember the arguments at the time was that, you know, Pitt County actually was founded on tobacco. And if we're going to do all this, then why is there not a law that prevents the growing tobacco? Except for maybe, I know that there's some medicinal purposes that can be derived out of it, but then, you know, it's a problem.
Yes, sir.
It is.
We always appreciate your wisdom on this. Okay, let's see, any other comments? Let's move on to the operating procedures annual review. And I think, does everybody have that in their handout?
Yeah, this is required by the state and by our accreditation body that y'all review the operating procedures for this board annually. We've not made any recent changes in this, so these are the same operating procedures that you saw last year. These were simplified several years ago. They used to be a lot more complicated, but the advice of the public health attorney, Chris Hoke, who was recently retired, these were revised to, I think, make them more usable and user-friendly and readable, too.
Does anybody have any suggestions or recommendations for any changes? Hearing none, is there a motion for reapproval?
So moved.
Is there a second? Second. All right, any further discussion? All in favor say aye.
Aye.
Any opposed? All right, those are reapproved.
Good, thank you.
So we'll move on to Health Director's report.
We're flying through. Several things I wanted to update you on. The grants, there was an article in this morning's paper about the opioid grant that had been received, so that was good news. We were one of 22 counties in the state that received that grant. It was for $44,440, I believe. And our plan with that is to pass that money to our existing syringe exchange program, eChem for Change, which has been in business or operation for about a year, a little bit more than a year, started last fall. And that organization, I think, has done a very good job. They're getting, building trust with opioid users and getting, starting to get folks in for referral for treatment and also for communicable disease testing like HIV and hepatitis B and C testing. So I think we have a good partner with that. If the demand continues to grow, I hope it doesn't, but if it does, I think our staff has been trained, and the possibility is there that we could do some of the syringe exchange activities at the health department if that's needed in the future. But I think we've got a good community partner with eChem for Change currently. So that's good. The other grant that we just mentioned was one that we applied for through Blue Cross Blue Shield Foundation, and that would be to help with the West Greenville Health Council initiative that's been going on now for several years. We had gotten a seed grant, I believe it was 3 years ago for that, and this would be for what we've applied for is a full grant, which we didn't get 3 years ago, and hopefully we can get this year. But we should have notice of that sometime in the next month, I'd say before the beginning of the new year, hopefully. So we'll wait and see on that. Amy Haddam has been hard at work. She's been preparing us for a site visit with the accreditation folks that are due to come next March. And she's about to submit all the paperwork that she's been burning the midnight oil getting done to, as well as the rest of our staff pulling things together for her. They've been very busy on that, but Amy tells me we're in good shape, it looks like, including our Board of Health activities that are required for accreditation. We've been accredited, this will be our 4th time, Amy. So, North Carolina is a leader in public health department accreditation. We actually did it probably better than anybody else in the country, and did it first, or one of the first states to do it. And we did it so well that the National Accreditation Board came down to North Carolina and stole all our people, unfortunately. But no, a lot of the folks who work for the National Board came from North Carolina Public Health Departments, which is good, and I think it's a testimony to how well we did it. We've done an outstanding job in terms of accreditation in the past, and I have no doubt that that'll happen again this next year. So I think we should be very proud of that. Our community health needs assessment. A lot of y'all remember we went into a collaborative this year to do our community health needs assessment that's done between the health department and the hospital. We've been doing that since 2006, every 3 years with the hospital. And this year, thanks to some folks at ECU, and we've managed to put together a regional community health needs assessment that'll cover, is it 33 counties? And that group hired a company who conducted the needs assessment, has done a lot of the needs assessment. We also did focus groups here locally and surveys that we submitted to them, and then they're going to report out the end of this month on the 29th. And that meeting will be at Eastern AHEC, right down the road here at the corner of Arlington and Highway 43. So if you'd like to attend that, you're welcome to. I think we're very excited about what the possibilities are with that new method of doing community health needs assessment. We'll be able to compare ourselves to surrounding 32 counties. So we're looking forward to getting that information at the end of the month. On a more sober note, we did have a warning come out from the state about acute flaccid myelitis cases. There have been some reported here in North Carolina. This has been in the national news. Children particularly have been affected by this in numerous states, mostly in the central northern part of the country, I'd say, but we have recently had some reports in North Carolina. We don't know the cause of this myelitis. It's similar to polio in that it causes paralysis. It was suspected that it may be related to an enterovirus that we had an outbreak of 4 years ago called D68. But that's yet to be proven, so we're not really sure yet what causes this infection. But we are notifying all the primary care providers in the community and others to be aware of it and to report it as soon as they suspect it. And the last thing I had was influenza. It is influenza season again, if there is one anymore, and we do usually get most of our flu in January, but we've had some pretty bad outbreaks in December too, and so we want to make sure, particularly after last year's season, we had a very severe season, which H3N2 type A flu that killed a lot of people across the country, including about 390 North Carolinians. Some of them were young, healthy folks, so we don't want to see that happen again. The vaccine has been changed again this year, but there's plenty of vaccines and numerous options for people. You know, if you have an egg allergy or if you don't like needles, they've brought the nasal flu vaccine back this year, so that's a possibility for folks who have a needle phobia. And so there's lots of choices to make. There's high-dose vaccine for those elderly folks that may have suppressed immune systems, and so there's really no excuse not to get vaccinated this year, we hope, and hopefully we won't have any deaths. We did have 8 Pitt County deaths last year, which is very unfortunate. So just urge people to get out and get their flu shots and vaccinate their families.
Dr. Morrow,
Yes, sir.
the disease that causes the paralysis, is that a permanent paralysis, or is there any indications that it's only temporary, or?
It varies. Some people have had temporary paralysis that comes back, and others have had permanent loss. There are some patients that have had actually surgery to do nerve transplants and muscle transplants that are sometimes effective. But yeah, it's very similar to polio, and it affects the motor neurons in the spine, and so it can be a permanent thing.
Thanks.
If I could just reinforce what Dr. Morris talked about with the flu vaccine, Bill Cleve, our public health epidemiologist, just reported Monday that we actually diagnosed, I think, 3 cases of flu last week at Vidant Medical Center. So these are very early. We'd heard of some sporadic cases elsewhere in the region, but we had not diagnosed any among our population served at VMC until this past week. So it's out there, and certainly would encourage you to, as Dr. Morris said, go ahead and get your flu vaccine. It takes about 10 to 14 days for you to develop protective antibodies after you get your shot. So certainly encourage you, folks that haven't had a shot, it's not too late. Go ahead and get your vaccine. And despite some of the old wives' tales out there, it is good for the whole season. So there's some stories out there, if you get it too early, it won't work later in the season and so forth. Well, CDC says it will work all season long. So don't hang out with the idea that you'll be more protected if you get it later. Go ahead and get your flu shot. And as Dr. Marr mentioned, they're available everywhere. Pharmacies, your doctor's office, health department, and so forth. So
We have plenty of vaccine at the health department. Our fee for that is $32. Is that right, Kim? There is a good amount of other viruses in the community right now. I think rhinovirus, parainfluenza virus, and even a little bit of respiratory syncytial virus, I noticed on Bill Clee's report, is starting to pick up. So that's normal about this time of year, that we start to see those other viruses that can look like influenza also.
After everybody gets together at Thanksgiving is when we usually start to see more people travel in, from different parts of the country, and then we start to see a little more flu after that. So, like Dr. Morrow said, get your flu shot. So, does anybody have any other business? Well, I certainly didn't mean to run through the agenda in a half an hour, but this is apparently what we got for tonight. So, any other comments? Hearing none, is there a motion for adjournment?
So move.
Is there a second?
Second.
All in favor say aye.
Aye.
All right, meeting is adjourned. Thank you.